welcome back. I'm going to start just by having you introduce yourself to the folks who are watching.
Right. My name is Joseph Njunge. I work with Find as a digital health technology officer.
Okay, so Joseph, tell us a little bit more about what Find does for those who may not be familiar with the organization.
Super. So Find is a non-profit global organization that is focused on ensuring that there is availability of quality diagnostics, to all those who need diagnostics.
That's great.
Yeah.
Okay, so throughout the year, what kind of trends are you seeing in digital health, and what advice would you have for practitioners who are maybe trying to use Find as a tool in their work, or more broadly trying to implement digital health projects successfully?
Okay. I mean, the trends that I'm seeing currently is there's a lot of convergence of data. There is a convergence of ideas. There's convergence of initiatives all geared towards improving patient outcome, or geared towards lowering cost, and more so improving access to right care and affordable care to all the patients across the globe.
That's great.
Yeah.
I want to ask you too about your case for hope, right? Like it's kind of been a rough year. We're coming out of the pandemic.
Yeah.
We have had a lot of global health crises bubble up.
Yeah.
A lot of other challenges in the world. If you think about the case for hope, maybe in a couple words, 3 to 5 words, what would those words be for you? And where does that question take you?
Well, I'm generally a hopeful person, so I think
Right,
five words will be will be too few. But here's my take. I think given the COVID pandemic, what has taught us is that there is really need for diagnostics. And what I'm seeing, why I'm hopeful, is that with digital health, we've seen how digital health can really catalyze and revolutionize testing. So we are talking about test and treat. We are talking about availability of ability to decentralize testing, and then through digital health, we are able to collect all that data and avail it to other consumers, maybe at the facility level or even at the national level. So I'm hopeful because digital health is playing such a pivotal role in ensuring that we have all this data converge into one single big and coherent story for care.
Joseph, I feel that excitement and that energy and that hopefulness in talking to you, and I wish you and your colleagues at Find a tremendous good fortune in your work as we turn the corner into 2025, and a great rest of GDHF, the conference here. So thank you so much for joining us in the studio.
All right, thank you.
All right.